How we can prevent from the HIV infection. Pre-exposure prophylaxis. Very, very important step for the prevention is the pre-exposure prophylaxis. We should take precautions. We should not share needles. We should not use the syringes, common syringes, blood transfusion, proper screening of the blood before transfusion is very important. So all these measures we can take before the exposure. So pre-exposure prophylaxis. Treatment as prevention. Antiretroviral treatment given during pregnancy, labor, and delivery. We know that it is transferred from the mother to the baby. So treatment during labor and delivery is important for the prevention. Sterile injection equipment, again, very important for the prevention. Protection greatly reduces the risk of transmitting HIV. So prevention is very important, and that prevention is mainly done by the protection. So protect yourself before you can get the disease. Post-exposure prophylaxis for 28 days. After the exposure, we should use the medicines for 28 days. So that concludes our topic. Thanks for watching.